So good morning, everyone. Susan kind of stole my beginning line because it wasn't very long ago that I was actually standing exactly here giving my master's research project. It was only a year ago, so it's good to be back at Brescia. And Heather Nadon, my colleague, is also a Brescia graduate, so we're really happy to be home. So thank you for welcoming us today. Our project today is entitled Losing Weight the Healthy Way, Using Technology to Increase Accessibility to a Healthy Lifestyle Program. Now we're going to quickly go over an overview of the project. So we're going to give you a little bit of information because this project is ongoing and we're actually changing it in order to try and increase accessibility. So we're going to discuss the actual program in existence right now and then what we're going to do. So that's the project innovation. We'll talk a little bit about research and the community and then how this can help improve population health.
All right, so thanks, Karen. So I'll just hold it here. Hopefully nothing bad will happen. All right, so as for Losing Weight the Healthy Way, what it is it's a healthy lifestyle program that we offer in Windsor-Essex County through the Health Unit. It's a 10-week course, and each class is 2 hours in length. And most of these classes, a majority I should say, take part in the evening. Daytime classes in the past have only been successful when offered to particular workplaces. I'm going to try and focus on this. Sorry. Can you guys still hear me? Yeah? You can still hear me? Okay, great. Sorry about that. Okay. So daytime classes have only been successful when they've been offered to particular workplaces. For example, Chrysler, where there's shift work. We have done that in the past through our workplace wellness program, but those seem to be the only time when daytime classes have been successful. But the goal of the program is basically to improve participant attitudes and beliefs related to healthy eating and exercise, and of course to aid them in weight loss and of course keeping it off long term. The class topics include things like preparing for change, as well as nutrition, basics like label reading, as well as fat, fiber, things like that. Physical activity, we talk about goal setting, we talk about understanding triggers and barriers. There's a grocery store tour that we provide as part of the class, as well as understanding the differences between hunger and appetite. We talk about fad diets, as well as hot topics in nutrition. Now, the target group that we have is all adults in Windsor-Essex County. And we did have some inclusion or exclusion criteria, but we did remove that in 2014 in order to increase accessibility to the program. And that criteria was mostly that it was for people between the ages of 19 and 65. They couldn't have diabetes. They couldn't have a heart history. As well, they couldn't be pregnant or breastfeeding a baby less than 9 months. And then they also had to be able to walk unassisted for 10 minutes. As well, the BMI had to be between 25 and 40. However, we would accept people into the program if they had a BMI between 40 and 45 with a medical referral from their doctor, and the doctor had to agree to follow them during the time. And that's because our program isn't medically supervised, like we didn't have a doctor on staff. There was just a dietitian that was facilitating the program. So the current cost of the program was $75 to attend for the 10-week program, and the cost includes a resource binder as well as a pedometer and the instruction by a registered dietitian. However, financial assistance is available upon request. Now the program itself has existed for just over 10 years, and as we know, over the last 10 years, technology has advanced incredibly. However, the delivery of the program itself hasn't really changed very much, with the exception of curriculum changes, due to up-to-date information, and of course we want to keep that always up to date. There are also some challenges with the program. For example, like I said, we only really offer it in the evening. As well, the community class is generally only offered at one location, and that's in our downtown Windsor location. So that does, just provides some problems for people in the county areas. As well, there's no childcare on site, and of course there's cost for the program. So with regards to the program innovation and how are you going to change this, basically at this point we are unaware of any other online healthy lifestyle programs available, really with the exception of Weight Watchers online, but that's very much weight loss focus. The program, or the point of losing weight the healthy way, even though it does have losing weight in the title, it sounds more sexy, right? So just healthy weight loss or healthy lifestyle program is kind of boring, right? It's not. So anyway, we kept with the title, but our focus is really to give participants the tools for slow long-term weight loss through healthy lifestyle change. So we're focusing more on the healthy lifestyle change aspect of it, of course with weight loss being one of the outcomes. And of course the real innovation of this online program, or the online Losing Weight the Healthy Way, is basically how accessible it becomes. So for example, participants can basically log on in the convenience of their own home when it's convenient for them. As well, there's no need to travel. It also can increase the ease of referral from local healthcare practitioners for clients. As well, the cost is going to be free, and there would be no need to find childcare for any participants that would need that. So Karen's up next here.
So for those of you who don't know Windsor-Essex County very well, the Windsor-Essex County Health Unit is actually the lowest funded health unit in all of Ontario. So we are working with a little less than the other health units are. And then our community dynamic too. We have some of the lowest fruit and vegetable consumption of all of the province, and yet we have some of the most fertile land. So it really doesn't match up what our community is doing to what our community provides. We have some of the highest incidence of smoking as well as obesity. So programs like this are necessary in our community. But partnerships and collaborations are key in order for us to actually be able to do these programming. As I said, we are pretty lacking in the funding department. So our research question that we want to find out, that we really want to discover, is can an online class really be as effective as an in-class program in promoting and maintaining those healthy lifestyle changes? And our objectives that we want to measure is that we want to determine, first of all, if the individuals who are lacking access currently are actually going to utilize the online version of this program. We want to assess user experience with an online program in order to adapt and improve uptake and effectiveness. Like we said, we have done literature searches, and nothing that we have found has come up with something that's currently happening in terms of this format. So we really don't have anything to compare to. We don't have anybody to talk to about best practices. We are trying to kind of hit the ground running and really assess what we're doing to make sure that it's effective as we go on. But we want to determine if there actually is a difference in the reported self-efficacy and behavior change for those who participate in our in-class versus this online program, because we really want to make sure if we're putting our efforts into it, it is going to be just as effective, if not more, than our current program. And answering these questions through rigorous evaluation are really going to be the only way we can determine the efficacy of the program. And really we have the potential to set groundwork for other web-based interventions if this is successful. So this project may address opportunities for professional education because it is a different approach to patient care. We can become more patient-focused if a healthcare practitioner can say, you're highly motivated, I see that you have the tools, let's get you into a program, and they don't have to wait until the next session starts. There's no time delay. There's no opportunity for that lack of motivation to start seeping in. So really they can get started immediately. And it may allow those who are motivated but have accessibility issues, time, money, physical limitations, as well as childcare or shift workers, they will be able to get the guidance and support that they need in a non-traditional, from a non-traditional classroom manner. But ultimately, again, research will need to be conducted in order to support this hypothesis. So really the current study will help to determine if the online program is as effective at reaching hard-to-reach populations in starting and maintaining a healthy lifestyle. And we want to know, will it help participating community members improve their physical activity and eating behaviors? And if losing weight the healthy way online is effective, it could be easily shared amongst community partners and other interested public health units. The platform will already be created, it will already be on a website. All that would need to be done is either the health unit itself taking that program, rebranding, or referring to the Windsor-Essex County Health Unit's website for that link. The course is already there, up and ready. So it reduces the amount of time and money other health units may have to invest because the groundwork is already laid. And hopefully it can drum up a whole different approach to healthcare instead of having to go and sit in a class for 10 consecutive weeks. So ultimately, this innovation will develop an efficient and sustainable way to increase accessibility to healthy lifestyle programs. That's it. Is there any questions?